Good evening. Hey, we've got a quick FAQ session on frequently asked questions from primary care providers about MASH. I'm Brian Lamb, physician assistant. Great to be with you. A common question that I get from my primary care docs or even from endocrinologists, other gastroenterologists who are mostly just doing luminal procedures, cardiologists. One of the common questions I ask is, which patients should I send to you? Which patients should I refer to GI Hep for further evaluation? I know my patient has fatty liver. They've got an ultrasound. It shows fatty liver. What's the next step? So basically, I just like to try to keep things simple. KISS, keep it simple, stupid. Just essentially repeat what the guidelines say. Do a FIB-4, based on age, platelets, AST, and ALT. And if the FIB-4 is above 1.3, send to me. 1.3 and above, send to me, or send for further GI evaluation. I just like to keep it simple for that. If the patient has metabolic syndrome, especially if they have diabetes, remember 1 out of every 3 diabetics has MASH, as opposed to just 5% of the general population. So the patient has diabetes, do a FIB-4, and if above 1.3, send to me. If the primary care doc wants to know more, I'll say, hey, look, LabCorp and Quest, they've got FIB-4 with reflex to ELF now. So you just order the blood test. If the FIB-4 is above 1.3, or if they're 65 and above and the FIB-4 is above 2.0, it will reflex to an ELF test. That's that test that's looking directly at breakdown products of fibrosis. And that will give you that kind of second NIT to know whether the patient has at-risk MASH. And if the ELF is abnormal, then you can send them to me. So that's what I tell them. Get the FIB-4. If you want to be fancy, do FIB-4 reflex to ELF. And then when in doubt, just send to me. Good luck, guys. Take care.